This is a work presented by a very talented research fellow working in our group called Biagio. She focused on this question because today, for patients who never smoked in their life, oftentimes the standard of care is a targeted therapies because these patients are enriched for targetable genomic drivers. But there is a large fraction of patients who have never smoked who do not have any actionable drivers, and so that's a challenging population. For these patients, ultimately, standard of care remains immunotherapy with or without chemotherapy. And we were interested in learning who are patients that do eventually respond to these therapies despite being never smokers. We do know that patients who have never smoked tend to have a lower response rate to immunotherapy, but some of them do respond. It's critical for us to understand who are those patients. And in this study, what we identified is that PD-L1 expression again or mutational burden, which usually do not work as well as we would hope in patients with oncogene drivers, for example, are still predictive of benefit, but we really need very high levels of PD-L1, 90% or greater, or mutational burden higher than the 19th percentile, for example, mutational burden. These two biomarkers can help us identify patients who respond. Interestingly, we also did note in the study specifically that using dual immunotherapy with PD-L1 blockade in combination with chemotherapy and CTLA-4 blockade was the treatment that resulted in the longest progression-free and overall survival in this population, suggesting that in this subset of patients we might need to consider this approach. Again, this is a study that is retrospective in nature, but it highlights how these patients could potentially benefit from immunotherapy, but we really need to understand better biomarkers of response in this population. Something that is very exploratory is the immunophenotype. We have learned through this study, for example, that the density of CD8 positive T cells, for example, or TILs in general, using machine learning on H&E slides, tracks with better outcomes. And so those are all additional findings that support the idea that a fraction of these patients might have favorable biomarkers that can ultimately produce also long-term survival benefits.